Hello, I'm Dan McKever, 58 years old. I first learned about Dr. G's clinic a few years ago when I was looking to remove my amalgam fillings, mercury fillings. I had a mouthful of them and had done just enough reading to know that I didn't want mercury in my mouth. So I was very impressed with the website that talked about careful removing of amalgams. Traditional dentistry will do it, but their protocols are not as rigid as in this clinic. So I had it done with Dr. Sani. She did a marvelous job and great bedside manner, calmed me down, and everything she did, it came out. All the amalgams were gone. So that's important to me because I've learned through my own experience with cancer. I am a thyroid cancer survivor. Back when I was in my 30s, I had worked with a nutritionist as well as a traditional doctor, and I have to say the nutritionist is the one that made the cancer go away, but she would adamantly say she does not treat cancer, she treats the immune system, and she knew what supplements I needed through extensive blood work to increase my immune system. So I had that in my own background coming here, knowing that mercury fillings are not good, and I want to keep my immune system just as strong as possible so that I don't have any problems later on in life. I don't want the cancer to come back. What I've learned here in this clinic, particularly from Dr. Sani, is your mouth is organic. The teeth can change positions. They can, and she explained to me that there's an arch that can develop with age to where the angle of the teeth makes it harder to get rid of the bacteria. Even with traditional cleaning, the bacteria can hide very well behind crooked teeth. And that really got my attention because bad bacteria can lead to other health issues. So to get your teeth straightened through a program called Invisalign is not just for aesthetic reasons, to have a nice smile. It is not just an aesthetic issue, it's a health issue. And I do not want a weakened immune system, and that's what can happen with periodontal disease. It can lead to other to other illnesses, serious illnesses, maybe heart disease, even cancer. I'm no expert, I just know what a lot of holistic medicine people have said. And so it makes sense though, because they show you the bacteria. They take a little sample and they take the sample to the microscope and they show you on a screen what kind of bacteria you have. Hopefully you have good bacteria, that's a good thing. But my recent visit for the first time showed some not so good bacteria, and that came to be simply because my teeth are crooked enough to hide bacteria so that the traditional cleaning cannot get to it. So my choice was to have a deep cleaning, which is kind of serious, or the Invisalign to straighten the teeth so that in the future you can have easily get rid of the bad bacteria, and traditional cleanings will take care of it. Why? So that my immune system is strong, because my nutritionist from the past said she does not treat cancer. I think I said that already. She treats the immune system. So for me, Invisalign is not just an aesthetic issue, but a health issue, and teeth are part of health. So I'm very pleased with this clinic, and they have a good policy where you can pay interest repayments over two years, and that's what I'm doing. And so I'm very appreciative of Dr. Sani, Dr. G, and everyone that I've met in this clinic. They all have a very good bedside manner. They care, and that's the biggest thing. But they're also competent. A caring, competent team is why I keep coming back here. Thank you.